Well, I'm pleased to present Dr. Kay England, the Chief Medical Examiner for Birmingham and Solihull, to present this presentation and update us on the upcoming changes as of the 9th of September. She presented at my regional SAFE meeting early part of the summer, and I was told it was one of the best presentations we've had this year on the updated system. This is a big change for the profession, probably since the cremation forms were updated in 2009. So I'll hand over to Dr. Kay now. Thank you, Dr. Kay.
Thank you, everybody. I'm so sorry. I'm glad the last meeting was actually in person and not online, but apart from apologies for my delay and technical failures, just want to talk to you about the medical examiner system. I am the lead medical examiner for University Hospital Birmingham, but that means I also have by default have been made the lead medical examiner for Birmingham and Solihull as a region which actually covers between 12 and 13,000 deaths a year. And I just wanted to give you some background. The background is that this all was first a concept back in 2003, so it's taken 21 years, but after 21 years and various other reports into various intra-hospital failings and disasters, starting with the Shipman inquiry and actually finishing up just recently with Lucy Letby, there's been a lot of concern that deaths have never been looked at. So Morecambe Bay, Gosport, the mid-staffs, but most importantly, Shipman, and now finishing up with Lucy Letby and the inquiry that's starting or has already started in the background about how deaths could happen, and no one really listened to the families, and especially mid-staffs. One of the biggest impacts of mid-staffs were the families said they weren't listened to. If you listen to Donna Ockenden's report into Stafford, into Shrewsbury and Telford, and the maternal deaths and neonatal deaths, and she'll find the same at Nottingham City too, is that families say they weren't listened to. And so this whole system is actually the most important point at the top, is to provide bereaved people with the opportunities to ask questions and actually raise concerns. Because the most important thing is that we are, although I'm employed by UHB in my role as a consultant, I'm actually employed by the Department of Health through the medical examiner system to be a medical examiner. Therefore, I have the opportunity to criticise my own organisation as well as any others that come under our remit. So that's to give in the points that you can see on screen. That's what we're trying to do, give greater safeguards for the public and healthcare providers, and all deaths that don't get referred, or well, all deaths that don't get investigated by the coroner. It's not ones that don't get referred, but a lot of deaths are referred to the coroner, but then the coroner says they have no jurisdiction to investigate or no need to investigate. So all those deaths will come back to the medical examiner system to be looked at. So hopefully we'll improve the quality and accuracy of medical certification. And that means that what goes on the death certificate actually more accurately reflects what actually happened, and actually follow the notification guidelines to the coroners. If we find problems in the community or in the various hospitals that each medical examiner office looks at, we have the authority to refer up to clinical governance structures in those organisations directly and actually say, we want you to look at this. And that's maybe where, in the Lucy Letby case, that's maybe where a medical examiner after 2 or 3 deaths would have started to say, hold on, this isn't fit the pattern of the last few years, why is this happening, have a look at it. And actually, once we've asked governance teams to have a look at it, they are really duty bound to take an investigation forward. Hopefully that aligns with the mortality initiatives around the country. And also, perhaps one of the most important things is all coroners these days are not medically trained. They are all ones appointed after 2014. They may have a dual qualification, but all of them are primarily legally trained. And so sometimes they come back to us, quite frequently come back to us to say, in your medical opinion, what does X, Y, and Z mean? And so that's quite we are acting as more and more as a resource for the coroner.
Thank you, Dr. Kay. Have we got any questions at the moment to go into the chat box?
There doesn't appear to be anything currently.
Okay, so how we actually do this, how we perform this role, is when a patient has died in hospitals, well, and for GPs, we ask the clinical team looking after the patient to tell us why they think, what they would propose that they would put on the death certificate. Then we actually have all the notes transferred to us either electronically. We don't accept any paper notes. So in my hospital, everything is electronic noting. And all the GPs tend to be on EMIS or System 1, so we've worked out a way in our region, and all regions are slightly different, but every medical examiner office, wherever they are, will have worked out with their GPs and their communities how to get the patient's records into us. And then we have a chance to go through them and say, well, yeah, actually, this patient was being treated for ischemic heart disease. They did have a heart attack last year. They have developed heart failure. Therefore, 1A, congestive cardiac failure or ischemic heart disease is a sensible and likely cause of death. So we're looking at the circumstances when they've been in hospital for their last admission, but we also have access all the way back through the spine and shared care connected and things like that. We can look back at episodes of their care, and hopefully we actually come to the same conclusion as the attending doctor, that actually we do agree that cause of death, and we hopefully don't really have to interact with them much more than that. Apart from saying, yes, we agree, you can issue that death certificate. But perhaps the most important thing that's a change is actually our team, either myself as a doctor or one of my trained team, actually ring the family and go through things with them and make sure, first of all, that they understand the complicated medical terms that are on the death certificate, and actually make sure that it makes sense to them. And if they have questions or concerns, we actually ask them if they, were they happy with the care, or did they have something they didn't understand or they were concerned about. And sometimes families find it easier to talk to someone that's independent. And we start by saying we are independent. We didn't look after their relative. And, and it gives them confidence to say, well, actually, I didn't like the ward was dirty, or, the nurses were uncaring, or the doctors were rude, whatever it is, they can actually say it. And obviously, we may find no evidence of that when we're looking through the notes, but we still record what the families have to say. And if it's serious enough what they have to say, or even, we will note their concerns, whether trivial or serious, and it may form part of a bigger picture. So that's what we do in terms of scrutiny. And so the important thing is having the families having an ability to talk things through. What is going to change, and as is on the screen there is going to be a new death certificate which will replace some of the paperwork that you as funeral directors will have seen before, in terms that one of the things that the key thing is that there will be no independent cremation paperwork issued from a GP or a hospital doctor after the 9th of September relating to the death. There are other parts of the cremation paperwork which I know Terry and Ross may be coming on to, or I can fill in a little bit, but it's less of my area. But after the 9th of September at 12:01 or 00:01 on the 9th of September, all the previous paperwork is effectively in the bin, and we have a new death certificate. We've already received books, and I know our GPs have already received books because we've already had death certificates completed in the new books, and we've had to send them back and say you can't use them. So they're not to be used until midnight on the night of the 8th going into the 9th of September. But the new paperwork has extra fields to compensate for some of the fields that were on a cremation form before. And as I think is coming on several of the slides that have been written by Terry or Ross, are some of the key points that are coming with that. So, I mean, as you can see, that it is actually, it's not so much when death is registered, it's actually when death is informed to the medical examiner team. That's when the clock stops in the new system, or the clock starts. Whereas death registration used to have to be completed with the registration service within 5 days after death, and that wasn't 5 working days, it was 5 days. Actually now it's when the medical examiner has agreed and signed off the cause of death. That's when the 5 days, and sends the form into the registration service. That's when the 5-day clock starts now. But as you can see, there's some examples there. Before the 9th of September, everything is as you have now, a CREM for your green certificate from the registration services. But come the minute after midnight on the 9th of September, which is a Monday, when we are sent a death certificate in from the community, or in from our one of our hospital doctors comes down to write a death certificate, the ME must sign on the back, and then we forward it on to the registration service, and that's when the clock starts ticking in terms of time. So it's not so much when the death is registered, but after the 9th, that's when the new paperwork is in play. And so if the death is registered, as you say, on the 10th, then the new paperwork. After the 9th of September, everything is the new paperwork. As you can see, these have been, this is literally a stepwise thing of what happens if a family member rings in or calls 999 and says someone has died, and the ambulance crew goes out and verifies the death in the community. The GP is informed, and then the GP, anyone who has seen the patient in their lifetime, and this is a key change for community deaths, and any GP who has seen that patient in their lifetime can actually complete the referral into the medical examiner service, which includes a lot of fields that are in the notes, so that you can just download them. And also they send us a proposed cause of death, either just as a proposal, or if they're confident, they fill it in on the death certificate and send it in to us. We will then scrutinise the notes, and if we agree with the cause of death, we will then sign the back of the death certificate to say that the medical examiner has completed appropriate checks and agrees with the cause of death. And then it's the medical examiner office's responsibility to forward that by email to the registration service. If we don't agree, we'll have to either get on the phone to the GP, assuming they've given us a back office number so that we can get through directly, and we will have a chat with them about why we don't agree. Otherwise, we'll send it back by email saying why we don't agree. More often than not, it's not actually that we don't agree with the actual cause of death, but it's the way they've written the certificate, and the order of things that they put down, or whether they put words in that we know that the registry office won't like. And if we really think something, if we really think that the GP has missed something, or has said, oh well, you know, the patient fell and they were found at the bottom of the stairs, then we'll say instantly, well, that needs to be referred to the coroner as a traumatic death. And so we will direct those things, and we will forward it on to the coroner and actually say, with a note from the medical examiner saying, well, we think this needs coronial review because of X, Y, and Z. If we agree with the GP or the attending practitioner as they're named, then we will sign the death certificate and we will forward it to the registration services. And it's the registration services that will actually issue the same, I think it's still going to be green, but actually it'll be issued to the informant or next of kin still has to go to the registration service and register the death as they do now. And then that's when the informant or next of kin will presumably have already instructed yourselves, you know, that the death has happened, and the paperwork will then come to you. CREM6, it's going to be called something different, but the CREM6 will still effectively be issued. The one thing that is very different for the registration service, and this may not affect you as funeral directors directly, is that no longer can the after the 9th of September, if registrars do not like what the wording is because we haven't put the word spontaneous in for subarachnoid hemorrhage or something like that, they cannot refer to the coroner. They have to refer back to the medical examiner. So that route of the registrars having information that they decide that they don't like the cause of death and they're going to refer to the coroner instead actually will no longer exist. If they do get extra information from the next of kin or informant when they're in the registration process, then the new role is for them to let the medical examiner service know what that extra information is. Maybe we didn't know that they had an operation in another hospital 6 months ago that they've never recovered from, for whatever reason that we don't know those things. But instead of just referring to the coroner, they have to come back to us. So that route is actually is taken out of the equation. So delays that sometimes happen for that, for silly reasons, usually about wording of what's on the death certificate, will no longer exist after the 9th of September. In hospital, it's a very similar situation. We have junior doctors coming down to us, but we are actually changing the process slightly, that they actually have to propose a cause of death in the notes so that we can see and hopefully come to an independent conclusion that it's the same cause of death. Same thing, we will go through the notes, usually of the last admission and then any other relevant things that we need. If we agree the cause of death, they'll come and sign the death certificate and we will sign on the back, and then again sent on to the registry office. Again, if we don't agree, we can phone the consultant in charge of the team and say, we don't agree because of this, or have you thought about this, or whatever it is that we have to discuss. And if we can come to some sort of agreement or conclusion, then we can sign get the paperwork altered if necessary, and signed and sent on to the registry office for the same, in exactly the same way as for the community. The CREM6, as I said, will be called something different, but if the coroner decides that there is a reason to complete a cremation form 6 or a burial order, then the coroner's paperwork will be issued by the coroner directly. And so those processes up to that point, once it gets to registration, I think that's when there is less paperwork for funeral directors to have to deal with post-registration, but any delays might actually have been built in before registration. But hopefully once death is registered, things should be as straightforward as they are for you or not at the moment.
So I think questions should come up there now.
Right then, so we've got a few questions in the chat box. If I can just point out a couple of questions we've had from numerous people with the same question. So as we are the funeral directors. How will we know when the GP has reported the death and sent the MCCD to the medical examiner's office?
Well, what you will know is when the death is registered with the registration service. The families will be informed when we speak to the families. Not only are we asking them questions about, do they have any concerns? Do they understand what is going to be written on the death certificate? Do the medical words make sense? And we go through all that. We also, at the time that conversation is ended, almost the last thing that's said to the family is, we are now going to send the death certificate through to registration services and give them in Birmingham, and I hope it's the same elsewhere in the country. In Birmingham and Solihull, the registration service has an online sort of pre-registration process so that the families can actually contact the registration service when they know their relative has died, and actually do a pre-registration form that lets the registration service know that this Jack Smith has died, and date of birth, date of death. I think that's the sort of thing they ask for, address. And then so when the paperwork comes through with us with the matching details of that family, then they know that they can contact the family to make an appointment for the family to come in and register the death. So the family are told that when we are about to send, and it's usually if we are phoning them in, on like today, they will, the certificate is then ready to go and will go to Birmingham Registration Office this afternoon. And so they will be told that the registrars are in receipt of, or will be in receipt of the death certificate in the next half hour or whatever. So in terms of funeral directors, I actually don't know enough of the process of, I guess my own experience was we told the funeral director when my mum and dad died, and all was taken care of. They knew we collected the paperwork down in Somerset from the relevant authorities, and went and registered, and the funeral director was already informed. But I don't think you will have a direct notification apart from your families or of the deceased. Unless you're dealing directly with registration offices, which I can't imagine you are in a great deal of cases.
Okay, thank you, Dr. Kay. Another couple of questions raised would be, how do we help the GPs if they're not fully aware of the new system? If they're not aware of the medical examiner's office, what can we do to assist them to issue the correct paperwork to the correct office?
The $64 million question. I have engaged with GPs in there are 200 GP practices in Birmingham and Solihull, and so far we've got 41 of them engaged in the process. So come the 9th of September, it's going to be chaos. And yet I have done countless things like this, actually technically more successful than the beginning of this one. But we have done countless meetings, issued out through the ICB multiple comms, and still people say they don't know about it. And still people are getting it wrong, because despite the new death certificates coming in boxes that say do not use to the 9th of September, they've already been used. So I don't know the answer. Smaller areas, have got better buy-ins from GPs. The 41 that have engaged with us are already very savvy with the process, and we're just encouraging them to pass it on to as many GPs in the area as we can. The bigger practices that cover lots of different, that are a conglomeration of lots of different practices, we are getting the message out there. But I've still had the GP support unit on email this morning asking, can we do another webinar next week and the week after, and we'll do them. And it comes in their education time. But to be honest, we don't know. The problem is, and I will blame the Department of Health and Social Care for this, there has been no, I mean, you ask a member of the public, they won't know this is coming. They really won't, unless they happen to be tied to anything that is involved with this. And that's the problem. There has been no public or professional, communication from the top down. We've had to try and get the message out from our own initiative. So 18 months ago, we set up a community working group with members of GP Support Unit from the ICB, or was then the CCG as it was, and we started developing a way to make it easier for GPs just to be able to press a button on eMissal System 1 to send us the stuff, so that they don't have lots of extra work. To be honest, I don't know what it's going to be like from the 9th of September on. I imagine in parts of the country chaos, and I don't think I can say our region will be any better, despite the attempts over 18 months or 2 years to meet regularly with, we meet on a monthly basis with this steering group to get the message out. The ICB have been putting messages out in every bulletin, and still some of the practices in Birmingham say they don't know what's going to happen.
Yeah, understood. One more question that's been posed. One more question that's been posed, Dr. Kayes. Will medical examiners be available outside of office hours to hurry along the paperwork for cultural and ethnic diverse funerals?
Yes. Now, I obviously cannot speak for each individual area, but I know that some places in the country have already got this worked out already. For my region, or for Birmingham, which has a big ethnically diverse Islamic population, we will be mirroring the hours of the registration service. Now, in Birmingham, you cannot actually register a death on a Sunday. Birmingham City Council has a registration service on Saturdays from 10 till 3:30, and on the non-religious bank holidays of 10 to 12:30. We will be covering those hours and a bit either side to be available. I think in Leicester, they're already up and running again with a big Muslim population. I think in places like North London, where there's a big Jewish population, similar, we are expected to cover the needs of the population that we serve. So we have technically the funding that's been issued to those areas is a little bit extra to cover that work on weekends. We will I'm sure, inevitably go to a 7-day service, but at the moment when this starts, my own service will be starting to mirror those hours of Birmingham Registry Office. So there's one registrar on duty at home on a Saturday and a bank holiday Monday, and we will have an ME available for community referrals to sign the back of the certificates, and hospital ones for faith, primarily for faith reasons. And whereas they're available 10 to 3:30, we're going to be available sort of 9 till 3, and we'll be available 9 till 12 on those bank holidays that the registration service is open till 12:30 from 10 o'clock. Other places in Nottingham, I know they happen to run almost a normal service on a Saturday, but the reason it will be different wherever you are in the country, and I'm afraid I can't give you a better answer than this, but neither can the National Medical Examiner, is because everything is being put down to local arrangements. And we've had an ME service in Birmingham for 10 years, way before the final introduction of this last couple of years that they've tried, but they haven't tried to standardise anything. So whatever we set up, and we have quite a comprehensive service with covering 3 big hospitals plus the community, we have sort of had to do, to make up as we go along. So whereas I saw a comment flash by about we've been doing this for, we've been waiting for this for 20 odd years and this is the best we've got. Well, I'm afraid, yes, the answer to that is this is the best we've got. And it comes because what should have happened is all of this should have been sorted out before a medical examiner service was launched. And it wasn't. It was sort of introduced after lots of pilot schemes had been set up by the Department of Health. So we were a pilot scheme back from 2014. So we've been doing this a very long time and we think we've got lots of it right. But then in the last few months, suddenly it's, oh, well, you've got to do this, this and this. And it was like, well, it would have been nice to have a little bit more notice. And this is where I say the communications from the top down out to the public who know nothing about it and to GPs who know not much more is poor, despite local efforts, that's very unfortunate, but it is how it is.
Yeah, of course. Thank you, Dr. Kay. Terry, can we move on to the next section, please?
Right, so yeah, so the key to the changes is actually the fact that they're scrapping the cremation paperwork from our side, from the medical side. I know that's not the same for you at your end of the process, but the documents are changing, and the death certificate is the key bit that changes. So the very key thing, so for GPs and deaths in the community, the most important thing is the 28-day rule is being scrapped completely. So any doctor who has seen a patient in that patient's lifetime before they die can complete the new death certificate. But there is additional information on the death certificate, and the pictures of it are coming up in the next couple of slides. We have to put our name and wet signature on the back of the death certificate to say we have completed the due process of scrutiny into the cause of death and agree with the cause of death. So that's the medical examiner side of it. Ethnicity comes on the basis of the Department of Health decided that after COVID, they realized they were missing quite a lot of information that ethnicity could give them about the population and causes of death. So they're actually they're asking attending practitioners or GPs or hospital doctors to complete that if it's been declared by the patient. We are not, as medical examiners or medical examiner officers, to ask the family what the ethnicity is. But if it's there on the medical record that the patient said they were white English or white Irish or black English or whatever, then it's the boxes to circle, which you'll see on the next slide. And other information is about maternal deaths, and to put everything in line with international standards, because the death certificate hadn't been changed for 70 years. The new death certificate is coming with a line 1D, so it'll be 1A, 1B, 1C, 1D, and part 2. And instead of the Crem 4 paperwork, there's a box for the doctor to sign about medical, or to say they have reviewed the body and that they know that the patient has no medical devices and implants. And that's what the registrars will put on the new green form, so that they inform people whether there is a potentially explosive device with a battery. And I think those changes are going to be changed in the other cremation paperwork. And this is what it looks like. So hopefully you can see it in reasonable detail. The top bit is actually largely the same, although the NHS number, if we can have it, is on there as well, because all of this data going into the medical examiner database nationally will largely be recorded by NHS number, but not everyone has an NHS number. And so that's the top bit is largely the same. And the key box in the middle, the cause of death, is as described. So it is the same as it is at the moment, 1A, 1B, 1C, but with the additional line of 1D. Very few patients probably have a 1D, some of the hematological patients. And this is the MCCD for any patient that dies after the age of 28 days. There are separate paperwork. There is separate paperwork, as there is at the moment, for deaths that occur in neonates. So within the first 28 days of life. It actually looks the same, but at the top does say attending medical practitioner for, you know, for children in the first 28 days of life. And underneath the same fields as before, information from postmortem not being held, reported to the coroner. So that's exactly the same as it is at the moment. But the new additional field on the front is actually about to try and establish whether patients had been pregnant before death, because there's a lot of concern that some maternally related deaths aren't actually being recorded at the moment. So those are things for the either the GP or the attending practitioner in hospitals fill out. Employment is the same as it is on at the moment, and the additional information box is there as well. And on the other side of the form, this is where you've got the ethnicity. So if we know it from hospital records or GP records, the GPs to circle one of those boxes. A lot of people have answered this in the census, and actually the GP already knows it, so it's actually relatively straightforward. But the implantable medical devices, this is the bit that effectively replaces the whole of the cremation paperwork from the CREM 4 part, since CREM 5 was abolished in COVID. And did they have any implantable devices? And simply a yes or no question. And if we say yes, then obviously the GP has to fill that in. If we as medical examiners, we're not actually responsible for checking whether that's right or wrong, but actually we are going to be, I think, especially for hospital deaths, we'll be looking at a chest x-ray, and the note should tell us if they had things like sacral nerve stimulators or fixing on nails or whatever. But I think technically we're not responsible, because that was one of the things that a lot of medical examiners were asking when this was first mooted. Well, who's going to take responsibility if £12,000 of tiles come off the inside of a crematorium because someone forgot that there was a pacemaker? Well, then apparently that is the doctor completing the form's responsibility, not the medical examiner's responsibility. But I suspect, certainly with where we have access to chest x-rays and medical notes, we'll be checking that as well. And then underneath it, the GP has to sign, and then the medical examiner has to sign underneath that to say that they have completed the scrutiny. That means that we've looked at the notes, that we agree with the cause of death, that there aren't any suspicious circumstances, and that we're prepared to add our signature to it. And that's when the certificate is completed, when the medical examiner has actually signed it. So any GP, and I mean especially GPs at this point, who haven't engaged and think that they can just send this form themselves into the registration service, as they do at the moment in Birmingham by email. It doesn't get sent by post or anything else. It's sent in by email these days. But if a medical examiner's signature that the registration service doesn't recognise, or there is no medical examiner's signature, then they will not register the death. They've been told that they mustn't register the death. They'll just return it to the GP. So the medical examiner actually has to sign that and send it on from our office.
Thank you, Dr. Kay. As you can see on the screen now, we've got some extracts from the new cremation Form 1, so we'll just go over those. Paul, there isn't a great deal of change on these documents, is there?
There's a couple of things, not a huge amount. The first page is slightly different in that it just gives your details rather than the basically the name and contact information. The second page, Terry, if you just flip over, again, is very similar. That's the applicant's details. The third page, the date and time, rather than being specific, states to the best of your knowledge what the date and time of the death of the person who has died. This basically was surrounding the fact that if someone died at 10 p.m. and the doctor wasn't verified till 2 a.m. the next morning, for example, a lot of the medical referees, when checking the forms, were asking dates to be changed left, right, and centre when the family were saying one thing, and simply because it wasn't verified till a different date that was changed. So that changing of that to the best of your knowledge hopefully will indicate to the medical referees in the first instance, whilst they're still with us anyway, shouldn't cause them to actually question and refer back to us with any issues that they may have from that. Doctors, again, the same. The pacemaker is a big issue, and this is one question I would ask Dr. Kay, perhaps. Many of the questions that are coming up and questions that we have is surrounding how we're informed as funeral directors, and we know it's going on the MCCD and back to the registrar, but we don't always receive notifications subsequently that there is an implant, because that form then goes to the crematorium. For everybody's information, I am in discussion at the moment with the crematory authorities, trying to see if they will actually put out to their members that they would inform the funeral director if there is a certificate that they receive that does have a notification of an implant. But then there is the question of who's responsible for that removal, particularly the rarer implants that we come across now, which obviously there's a lot of discussion over how those are removed, who removes them, because they're often beyond the skills set of a simple funeral director like me. And I don't know, Kay, whether you would, a lot of people have asked, is that the responsibility of the medical examiner to state that an implant is present, what it is, and whether it's been removed, or are you aware of that being somebody else's responsibility? Because we haven't actually had clear notification from government departments as to whose responsibility that is at the moment.
No, I mean, it's one of those little black holes that have sort of popped up that suddenly, whereas at the moment when junior doctors say are coming into the ME office to complete the cremation paperwork, because that's where they have to come and do it, our MEOs are going through it. We also make them check a chest x-ray if they haven't actually looked. If they go, well, I don't know, well, we go, well, it's obvious from the notes that the patient hasn't had a sacral nerve similar to those sorts of things. We would normally know from what's in the noting, but sometimes, they just say no. So we say, well, look at the chest x-ray. We actually sit there next to them saying, look at the chest x-ray. So, they're signing, and actually, of course, I work in a hospital, in all three of the hospitals which are at UHB. All the morticians tend to take all those sorts of things out. All our mortuary staff will take them out before they get to the funeral director. But what happens in the community, I don't know, and I don't know who's going to be responsible, because this is one of the things that we asked: are we signing to say we know that there isn't isn't an implant? And what the resounding thing came back in June at the last National Medical Hospital Examination: no, we are signing to say we agree the cause of death, not that we know or don't know whether there's an implant. So it's going to be difficult for our in-hospital ones. I think the process will still be the same. I often am the one signing the authority to remove the pacemaker, to send it down to Dave in the mortuary to take the pacemaker out, on behalf of the family. So we'll say we'll take it out. But from the community, I don't know, and I don't know who's going to be responsible to say it is or isn't, and I don't know whether you guys will have have cover for that, because if the GP is saying, well, no, they haven't got one, is it because they know they haven't got one, or they just don't know? So it is. I don't know. It's an unanswered question, and the crematorium referees are still in place for at least 6 months. So despite the medical examiner system supposedly taking responsibility for a lot of things, the government has either bowed to pressure or realised that they actually don't know how this system is going to bed in terms of cremation and as a means of disposal, so that the crematorium referees will still exist for 6 months. And so they are not shy and they're not backward in coming forward when they are not happy with the information they have. I know because Heartlands has received 3 this week that said, you didn't say the fall was non-contributory to the death. So the cremation form has had to be rewritten, even though it was non-contributory to the death. So they will still be in place, and so hopefully we'll still have the final look at things as an oversight. But I can't, unfortunately, it's an imperfect system that has been sort of speeded up in the last few months, when I think they haven't thought of all these details, and I'm sorry I can't give you answers. All I know from an ME point of view is we have been told we are not signing that death certificate to say we agree there is or isn't an implant. We're agreeing or not agreeing with the cause of death.
Okay.
And so that's not a very good answer for your guys. I accept that, but I don't know the answer, and I don't know that they've actually thought about that from the final disposal point of view.
Well, I think it's evident that they haven't, frankly.
Yeah.
And it's a question that we're asking constantly. And on behalf of our members, we're desperately trying to get answers for these questions, but it's proving challenging, to say the least.
Yeah.
So just the last piece of the Crem one, the application form, again, we've still got the disposal of the ashes in the same manner. And a point on there about the disposal of metals now. So it's very similar. You'll be familiar with it. It's just a question of rereading it when it comes through, and crematoria should be receiving them imminently by all accounts. I was told last week that all the documentation should be out and in the public domain by Friday of this week, but I still hold my breath on that, so we shall see. And the statement of truth is exactly the same as previously. One other question, if I can just throw in, Dr. Kay, that somebody asked very early on was with regards to whether the ME system will have any effect on the removal of deceased out of England and Wales, so cross-border or moving people abroad. Will there be any additional requirements over and above the requirement to inform the coroner?
Exactly as it does at the moment.
Yep.
The coroner still will have to, for our in-hospital deaths that request to go out of England, the family have to bring in a passport. The doctor has to confirm that it's the patient that they were looking after or they've done the paperwork with. The out of England and free from infection forms then go to the coroner, and she issues, the death has to be registered, and then the coroner will issue. It's the only thing that they, apart from organ donation deaths and things that as an ITU consultant I discuss with the coroner at weekends, it's one of the few things they do in Birmingham out of hours on the weekend.
Excellent, thank you very much. Ross, I don't know if you have any others particularly that you've picked up on while I've been talking to Dr. Kay.
No, I think we've covered a lot. The 5-day rule for registration is still active and will be in place. However, as I'm sure many of you know, deaths are generally registered within 5 days. Dr. Kay, have you got any update on that?
Well, yeah, it's 5 days from when we send it, when the medical examiner has agreed the cause of death and has sent the form to the registration service. So actually, for the family, that's slightly longer. And again, there's still no plans from the registration service to prosecute anyone when it isn't done. But so if the GP or whoever sends it to us on a Monday morning and we process it and get them to sign the certificate and we sign it on the Monday afternoon, send it off for registration, that's when the 5-day process, actually, that's when the clock starts then, not when the patient dies anymore. So that's a little bit sort of longer for the families. So it is when it's sort of received by us and agreed by us, not not at the time of death anymore. Really, okay. From the process, as someone commented, he didn't need to know, he's not a doctor, didn't need to know about what's happening before. In some ways, the process up to the point of registration potentially won't affect your service as much, apart from it may be slightly longer. The family may tell you on a Monday that dad died on the Sunday and they were instructing you to deal with the funeral. It's then about the time it takes for the GP to send, for the community. It won't really change very much in hospital at all. As I said on the meeting when I was attended near Wolverhampton, if you haven't realised there's been an ME service at Birmingham and Solihull for 10 years, then actually that's quite a good thing, because we've been quietly getting on with it and just doing it anyway. The difference really will be for the GPs to send us the stuff by email, and us hopefully to immediately agree what they proposed as cause of death when we scrutinise the notes, which usually takes an hour, maybe half an hour, maybe an hour, maybe a couple of hours for a very complicated case. From then we'll send it, we send back by email to the GPs, if they haven't sent us in a completed death certificate from their end, we ask them to then write one and send it. We then will sign the back and send it on to the registration service. So in that sense, nothing really changes. That should happen within a couple of days. As long as we get the stuff in from the community, we will be processing it. I mean, our turnaround times for most ME offices, I don't think of that, haven't added a great deal of time, but it is an additional step. So you can expect that if your family informs you on a Monday that one of their relatives died on a Sunday, that maybe the death isn't registered to the Friday or whenever. So maybe it's the next week before you get to do anything. I don't know what the timescales are going to be, partly because at the moment across the country, approximately only 50% of community deaths at this point are being registered. And I think that's the National Medical Examiner being quite optimistic. I think they're less than that, but and certainly in my own area at the moment, only 20% of GPs are on board. All the community hospitals are, all the hospices, and the other places like the Royal Orthopaedic Hospital, Women's and Children's, all these are all on board, but still 160 out of 200 GPs aren't on board. So come the 9th, I expect everything to slow down a little bit, but we generally process things within the course of a day, and we have enough MEs on board in my area, and certainly I think there are over 2,000 MEs trained according to the National Medical Examiner, and some areas will be very small. Some areas will only cover 3,000 deaths, which may cover several areas of a rural community.
Yeah, that's right.
So,
Dr. Kay, can I just jump in there? Sorry, because there's a lot of questions coming through at the moment. Timescales, do the medical examiners have a framework of how long they have to respond to a death or MCCD being sent to them?
Well, ideally, we would say that we would deal with it within I think the National Medical Examiner says we should be dealing within 3 days. I think most medical examiners offices are trying to deal with things quicker than that.
Thank you.
So if we get informed on a Monday, we should be sending things through to the registration service on a Thursday.
Okay, thank you. There's a few questions around fees. Just to clarify, there will be no fee for cremations going forward. The £82 fee will be obsolete as of the 9th of September.
It's a centrally funded service. You can imagine the uproar in the faith communities that don't have cremation if they were suddenly being asked to pay for an ME service they didn't ask for. So no, there are no fee. It's all being abolished. It's all centrally funded from the Department of Health and Social Care.
Yeah, correct. There's been a few questions around release of deceased from NHS hospital mortuaries. Ultimately, it's down to the individual NHS trust if they require sight of the green certificate for the deceased to be released. So that's a regional issue to take up with your local NHS mortuaries.
Yeah. Yeah, I think so. I mean, having living memory of someone being the wrong body being released from my trust sort of in the last 10 years, I think, yeah, the paperwork has to come through before anyone gets released out the door these days, and it has to be at least the 3-point identification and stuff that is required on most things. But certainly, I don't think none of that will change. I think that even for rapid releases where we're going to be working at weekends to make these things happen, our site team will still need the paperwork to say that the body's been registered and whatever to, the green form or whatever to take it out. Sometimes I think that in the past there have been the family sign in to say they'd like the funeral director to take care of the body earlier but I think that's been tightened up from my own trust because of the release of the wrong body with the same surname sort of thing. So I imagine the processes that are in place in hospitals for funeral directors that are currently in place won't actually change at all.
Thank you, Dr. Kay. Paul, have you got any other comments?
I'm trying to answer as many questions myself in the chat box at the moment, but there was one there about burial, question of whether the ME is involved with burial, which I know you will be as well. But you talked about faith funerals and obviously the speed that some of them require things to be turned around. Is that going to be feasible with the new ME system for them to get turned around in that short of time?
I mean, we'll have the same priority. What we ask from the community desk, because we know what happens in hospital. If we have a Muslim death on the wards in the hospital and the family wish to, then the team have to come down and give us a cause of death, and we'll get it processed as quickly as possible. For the community deaths, reason we're working on a Saturday is to allow those deaths to be processed so that they can be registered on a Saturday. And so yes, we hope we're going to allow things as smoothly as possible. Obviously, the same criteria still apply. The biggest thing is when families are requesting a rapid release for rapid burial or funeral and burial, is when we actually say, well, I'm sorry, this has to go to the coroner. And that usually causes quite a bit of uproar, but the law is the law. And, we have to say, no, sorry. And so if something comes into us and we're reading the notes and saying, actually, no, we can't agree this cause of death, this needs to go to the coroner, then it will still need to go to the coroner, and no, there will be no rapid release. And if, obviously I can't control what is happening out in the community. All I can say is legally this has to go to the coroner, and we will make the referral to the coroner. And the coroner, all coroners across the country, after the problems in northwest London, have a system where they have to if families ask for prioritization, usually for faith grounds, but not always. it may be that families are over from Australia and they need to go back in a few days' time, and they need to get everything sorted and the burial happening, or the whatever happening. Then a request for priority is put on to those that are informed to the coroner, and we ask the GPs to do exactly the same for us. If they're looking after a family who want a quick turnaround funeral for predominantly religious reasons, then if they put that on the referral form into the ME service, well, then we will prioritise them in the same way that the coroner does. So we will try and make sure that those their religious circumstances are taken into account. Obviously, in an area like Birmingham, this is one of the things the coroner often says and has a moan about, is that whereas other areas may only have one request for priority, we might get 8 or 10 or 12 a day, and that's the thing. Then how do you prioritize? Then you're going to have to do it in the order they came in, I suppose. But we'll see. We haven't got there yet, but we know that we expect to prioritize. If it's flagged up to us, we will prioritize those that have requested for religious reasons that they want a prompt turnaround.
And there's nothing in your guidelines, Dr. Kay, that give you a time limit that you have to have done the inquiry by?
Well, I mean, ideally it's as quickly as possible, but as is often stated, it's as quickly as long as it's done right. I think the figure that we originally said, we personally in my service like to get the paperwork in, reviewed and out, and certainly by the 3rd day. But I think that in terms of national guidance, it says something like as quickly as possible. I think, within a maximum sort of 72 hours. So and that will depend on how well staffed units are, and whether you get, as happens in my hospital, you could get sort of 50 deaths over a weekend. So on the Monday, just in the hospital deaths across the 3 sites, you may have, there are 50 deaths that you're having to start processing. And so, we have enough MEs that mostly those are done within the first couple of days. But our limiting factor in hospital is getting junior staff to come down and write the paperwork. But we'll be able to say, well, we've reviewed the notes, we agree the cause of death, now come down and write the paperwork. And hopefully with GPs, we will have, as much buy-in as that. But there will be GP practices that are still single-handed GPs who perhaps can't get to the paperwork the same day. So our limiting factor in what comes into us would be how quickly it comes into us as to how quickly it comes back out.
That's for you to dictate. It's not something that you have specific written guidlines on.
No, but there will be a there will be a standard that I believe there is nothing I have seen written down that says, I believe the guidance is that we get the stuff out within 3 days. We try and get it out quicker than that.
Thank you. There are some questions coming in that have concerns with regards to infectious cases and how funeral directors would be informed of those. They often used to get picked up off the CREM 4 and so on, but we obviously wouldn't see that now and wouldn't see the MCCD. So can you give us any guidance as to how we might be informed?
I don't know. If it's in the narrative on a CREM 4, then yes, you'd see it. But unless and if you don't actually see the death certificate to know that someone may have had hepatitis B or something like that, I actually don't know. And that is obviously another gap for you to talk about. How do you, because you won't, whereas we would know by looking through the notes, because in a way that some of that information is still confidential to the patient, unless there's a specific thing that we would, a specific form to let you know that. I don't think we'd necessarily be flagging it on the front of the mortuary doors saying, well, they would know. The mortuary staff would have, if someone had hepatitis C or hepatitis B, it would probably be on the you know, coded on the front of a fridge door in the mortuary. But whether they're telling your members that, I honestly don't know, because there won't be any paperwork as it is at the moment for us to fill in to say this patient, only if they're going out of England. That's the only time we fill in anything to send to the coroner, or also to send to the airline to say whether they have to be a closed coffin or not. You know, I don't think we send anything else out that mentions it. And I don't think there's any paperwork that will come through the ME service that would allow us to do that, in the sense, or require us to do that. We might do it out of good practice for you guys who are coming to collect at the mortuary door, so to speak. But I don't think there's anything that sort of says you must tell the funeral director this, this, and this. And perhaps that's another gap that actually needs, you know, to be addressed. For in hospital, we can probably arrange to do that. But again, out in the community, I might know from looking at the notes that someone had a certain infection, but from what I will fill in, which is signing the death certificate and agreeing the scrutiny, which will go back to the GP as a critique of their care, of the patient's care, having spoken to the family and stuff, there will be nothing that is actually specifically written to go to a funeral director. So that's another, I'm afraid, another gap that they hadn't actually thought about.
Thank you. Hopefully the mortuaries, which in the main tend to advise us accordingly if
I think
there is anything currently.
Staff, I can't believe that our mortuary staff wouldn't tell the funeral directors turning up at the door that.
I think there may be some different practices around the country, which is the concerning thing.
Mm.
Ross, is there anything else that you?
I'm just making my way through the questions. There's nothing that's really standing out at the moment. However, if anybody has got any concerns still after this meeting, please email them into the business centre and we'll come back to you as soon as we can. This presentation will be emailed out and made available to all members in the next few days to distribute amongst your teams and to re-review. Obviously, the business centre is available for any queries from members regarding this new process.
I mean, I'm happy to. I mean, always in these meetings, I never get a chance to look at the questions as they fly through. If I'm happy, if they're available afterwards, I'm happy to try and answer any that I can. So you know, I think it's unfortunately. And I think it's actually a very good idea what they're doing, but I'm not sure it's been executed in necessarily the best way. I mean, obviously, I've been a medical examiner for 10 years. I obviously think it's a very good idea, but you know, it's and I thoroughly enjoy it. But actually, as we're hurtling towards the 9th of September in 4 weeks minus 2 days, I am less sure that it's as joined up as even as I hoped it would be. And meetings like this perhaps show that there's an end step that they haven't, or steps between registering the death and the patient being buried or cremated that they haven't actually thought about. I thought they hadn't thought about quite a lot of things up to that point, but I think they haven't thought about how you deal with things after registration, because registration to a certain extent is where we stop. But I can see that there could be issues post-registration, pre-burial, pre-cremation. Well, more pre-cremation than pre-burial. Right.
I think not as any fault of your own, Dr. Kay, but I don't think this has given many of our members much encouragement leading into the 9th of September. And certainly there's a lot of concerns still out there. So your offer to answer any questions was very much appreciated. And likewise, everyone, I know that time's getting on and it's late in the day now. We've overrun time anyway. Yeah, obviously, we will endeavour to answer questions. We've tried to do some as we've gone along, but we will endeavour to answer any questions that have been in the chat as well. And obviously, we can perhaps forward any that we don't have the the skill sets for onto yourself, Kay, maybe to help with that.
Yeah.
But I think we're probably, unless Ross, you're aware of anything else that we need to keep Dr. Kay for, I think she's probably, bless her. Thank you very much, and you've answered what you can at least today, which is all we can ask of you.
Thank you very much, Dr. Kay.
Lovely. Thank you very much. All right. Thank you.
Thank you. Bye bye.